Hi, I'm Dr. Lauren Mathewson. Today I'm going to be discussing immune supportive therapies, thinking outside the box. I'm a naturopathic doctor here in California. We have offices in Roseville and Folsom, California. So today I'm discussing immune support, and I'm discussing immune support therapies that are kind of outside the box. So traditional examples of immune support that we always think of, kind of the first things that come to mind would be things like vitamin C, getting enough sleep, eating high quality foods, and exercise. And these are all absolutely, I would say, foundationally critical to a healthy functioning immune system. There is also more we can do beyond that. Did you know that spending time with your friends makes your immune system stronger? Spending time with friends and loved ones in a way that feels emotionally good and you feel comfortable and you're laughing, that's immune supportive in and of itself. In the same way that spending time around people that maybe stress us out or maybe we have challenging relationships with, that can be hard on the immune system. So when you're thinking about immune support, it's not just about kind of the things that we always think of, it's also who you choose to spend your time with. When you sit down and share a meal with people that you love and that you care about and they care about you, did you know that your body is actually doing a better job of digesting and absorbing those nutrients than if you're eating that exact same meal, maybe on the fly, or you have a deadline and you're not sitting down and you're eating alone? When we're relaxed and we're with people that we love and we're laughing and we're calm, your body is in a different state of its sort of central nervous system. You're in more of a parasympathetic state when you're calm. Parasympathetic state is great for, again, digestion. It's good for absorbing the things that you're eating. It's also really, really good for your immune system. That's when your immune system does its own self-regeneration and repair. So I know I touched on sleep, but we just can't over talk about how important sleep is for healthy immune functioning. And this applies to men, women, all ages, kids, adults, elderly folks. Your immune system does its repairing and rejuvenating while you're asleep. So people who are getting poor quality sleep, your immune system just isn't having a chance to go in and kind of do that foundational work that needs to be done. Aside from how important it is for your immune system to get proper sleep, we also need to remember that sleep is when we release most of our hormones. In particular, men release testosterone while they're sleeping. Testosterone isn't, while men are awake and motoring around during the day, that's not the time that their bodies are making adequate levels of testosterone. And we know that testosterone is really important for proper immune functioning in both men and women. We have study after study that show that men who have obstructive sleep apnea, or they have fragmented sleep, meaning they sleep for a little bit and they wake up and then they sleep for a little bit more. If those are the kind of only issues they have, when we control for all other factors and compare them with their peers, the men who are getting poor quality sleep or not as much sleep have lower testosterone levels across the board. We know that low testosterone levels correlate with higher rates of chronic disease. So again, really important to sleep, not only for your hormones, for mood, for energy, but your immune system. This is so, so important. Moving your body and exercise, also critical for proper immune function. Now, exercise, I just can't overstate how important it is for healthy immune functioning, but this doesn't have to be, super strenuous. You don't have to go to boot camp. What you should do is find something that you enjoy doing with your body and then make time for it. This can be things like dancing or hula hooping. I love working in the garden, even taking walks with friends. You're outside, you're moving your body. That's so, so important. That's good for your nervous system. It's calming for stress, and it keeps your immune cell populations nice and healthy. Laughter is so important for healthy immune functioning. Not only does it improve your mood, but it also causes a positive increase in CD8 cytotoxic T cells. So there was a study done in this journal that was looking at how laughter influences, again, specifically the immune system. And these researchers found that even forced laughter, so when you don't genuinely think something is funny, but you're going to kind of go through the motions and you'll laugh anyway, that even that forced laughter has a positive response on the immune system. This is in line with what we've known for a long time about how the our facial muscles provide direct feedback loop to how our emotional state is feeling. So we've known studies show that if people put on a smile, that the muscles involved triggering to make that smile happen on your face tell part of your brain that you're in a better mood than maybe you were. In the same regard, frowning tells your brain that you're in a poorer mood than you maybe are. So I'm not telling you to go out and fake laughter and fake smiles, but this is just to reemphasize how important it is to your body that you engage in genuine laughter and engaging in genuine smiles as much as you can. Deep belly breathing. So this one is great for kind of keeping people calm. But deep belly breathing does that same parasympathetic nervous system support as I was kind of mentioning earlier. And again, the parasympathetic nervous system, that's the state where we're relaxed, we're digesting, we're calm, our immune system is repairing, as opposed to the sympathetic state of nervous system. That's that sort of hyper arousal state where, you know, you're alert, maybe heart's beating a little bit faster. You're kind of waiting for, is there a jungle or is there a tiger about to jump out of the jungle and pounce on you, right? So parasympathetic is that calm state. I love deep belly breathing as a tool to help people get into parasympathetic state of relaxation. So one of the breathing, and there's so many different breathing techniques, and I think a lot of them are really wonderful. The one that I kind of encourage folks to do is this. You inhale for a count of 4 through the nose, hold for a count of 7, and exhale for a count of 8 through pursed lips, kind of like you were whistling, but without actually making the whistle noise. And you repeat that maybe 10 to 15 times as tolerated for you. Anytime you're exhaling twice as long as you're inhaling, it's telling your body that you're not in danger, that you can calm down. And again, like I said, this just helps move you from that aroused sympathetic state of being into that more relaxed parasympathetic state. The other lovely side benefit of deep belly breathing is it really is beautifully supportive of moving lymphatic fluid back up to the heart where it belongs. So this is a great technique that, you know, it's one of those things, the more you practice it, the stronger the effect is on you. So I encourage this definitely, for sure. Intermittent fasting and fasting mimicking diets are a way to, through the use of not even nutrition, but the timing of nutrition, to help support your immune system. So I ask a lot of my patients if this is appropriate for them. And again, before you start any sort of dietary or nutritional changes at home, please check in with your healthcare provider. Now, for the patients of mine that I think it's appropriate to do intermittent fasting or fasting mimicking diets with, one of the easiest ways to start with intermittent fasting is to fast overnight every night for 12 hours. Once that fast is comfortable, we want to stretch the fast out to 14 or 15 hours, 2 to 3 days a week. Now, the research is showing that whenever we're fasting past about 14 hours, your body's going in and doing these sort of deeper states of housekeeping that it's not doing when we're constantly eating. And one of the really important things that it's doing during that deep housekeeping is killing off dead, dying, damaged cells. And cancer cells often fall into that category of cells that are damaged or don't fit the profile of a normal healthy cell. So certainly I'm not suggesting that intermittent fasting is going to directly kill off your cancer cells, but it is a way to keep your body's immune system primed and on the lookout for those cells. The other side benefits we see to intermittent fasting or fasting mimicking diets are an improved sensitivity to insulin, lower rates of prediabetes. It's very, very well established that poor blood sugar control is associated with diabetes and obesity and heart disease and lots of downstream health states that are we would rather avoid if we can. And a lot of those health states, things like diabetes and obesity, are in and of themselves independent risk factors for the development of certain types of cancers. So this can be a beautiful way to help prevent the development of cancer. We can also use intermittent fasting if we already have cancer, and we can use intermittent fasting as a way to maintain remission sort of post-cancer treatments. This is my favorite one. I found an article that was saying that having a beneficial relationship with your doctor, having a relationship where you're comfortable with your doctor and you feel like you're being heard and you feel like your concerns are being addressed and you feel confident and you have trust in that relationship, that relationship in and of itself is therapeutic, regardless of any of the therapies that your doctors may recommend to you. So this is so interesting to me, and this is something that I sort of had noticed with my patients and had intuited before I even found this article. The article I found, when I have references at the end of this, it was just looking at people who have the common cold, so sniffles, sore throat, headache, sort of body aches and pains, and the patients who have those symptoms, but they found that they reported that they had an empathetic relationship with their doctor, that when they talked to their doctor, that their doctor listened to them and empathized with them, that they were recovering faster from their cold and their symptoms weren't as severe, as opposed to the individuals who didn't have that sort of emotionally fulfilling relationship with their doctor or a relationship with their doctor at all. So I just think that this is such an important part of medicine that I don't often really chat about, and I don't really hear touched on very much, but I think it's crucial. And now in that regard, you don't have to have an amazing relationship with every member of your healthcare team, but it certainly is very important. I would encourage, and I would consider patients that do have a good relationship with their doctor to be very thankful for that. And if you have a relationship that you're not super satisfied with your doctor, either work on it or consider finding someone to work with that you do kind of gel with, right? So again, it's important to have trust in your healthcare team, and it's important to be able to talk about the things that are on your mind. So I just loved this article. I thought that was so cool. I've provided some of the references of some of the things I kind of touched on in this talk. Here are, again, this first article here was that perception of empathy in the therapeutic encounter, like I mentioned about people who had the cold. I included a quick little reference about how powerful that deep belly breathing can be in terms of immune support. And then finally, I've got an article here about how important humor and laughter are. Now, if you are interested in hearing more or learning more about the work we do here at Revolutions Naturopathic, you're always welcome to reach out for a free 15-minute consultation. Our front desk phone number is 916-351-9355. Thank you so much.